Hello, my name is Gracie O'Reilly, and this is my case study 1 for SPCE 683, section 805. The date is October 13th, 2024. This presentation will be referring to the 5th edition task list items F1, F2, F9, F6, and F3, which are the client description, determining the need for behavior analytic services for that client, interpreting functional assessment data, and describing the common functions of problem behavior derived from that data, as well as identifying and prioritizing socially significant behavior change goals. Beginning with task list item F1 regarding the client description, their age is 3 years and 7 months, sex is female, diagnosis is autism spectrum disorder, diagnosed on December 7th, 2023. They also have a comorbid diagnosis, which is mixed receptive expressive language disorder. Regarding family and social history, their mother has anxiety and experienced gestation at 38 weeks during pregnancy. Their brother has a language delay, and they are the youngest of 4 siblings, living with all siblings and both parents. Past services include occupational therapy, speech therapy, as well as ABA therapy for 18 hours a week. The duration was about 4 months before starting ABA therapy at this current clinic. Current services are public schooling, in which the client has an IEP, as well as ABA therapy for 19 hours a week. Continuing on with the client's description, as far as communication goes, their first word was at 10 months. Parents noticed a speech regression around 12 to 15 months, and they do have difficulties requesting, often requiring additional prompting, though they do demonstrate some spontaneous requests with the carrier phrase. Frequently, they physically guide or gesture as a form of requesting. Regarding listener responding, they respond to their name and follow single-step directions inconsistently. They do have very strong motor skills and can imitate most fine and gross motor actions. Moving on to social and play, they do initiate play with family, though prefer solitary play. Difficulties with sharing cooperative play or presence, and they do engage in pretend play frequently. Regarding academic and cognitive functioning, they have moderate emotional recognition and are able to label and express hypothetical emotions. They are able to tact many environmental stimuli, though do require additional prompting to follow or transition through a routine or schedule. Some final notes regarding the client's description are self-help skills, in which they can self-dress, complete general hygienic skills, and feed themselves. They're also able to void in the toilet, though require some additional prompting to initiate the use of the bathroom. Behaviors currently being measured are tantrums, screaming, and self-injurious behavior that we will get more in depth in later on. The client's preferences are pretend play, Play-Doh, sand, paint, books, singing, audible puzzles, instruments, as well as chocolate. An objective description based on direct observation of the client is that they are playful, imaginative, and fairly independent. Moving on to information related to task list item F2, which is determining the need for behavior analytic services. I did include the client's Vineland scores, in which most domains fall below average. Main areas of need for services include communication, both expressive and receptive, as well as socialization, including interpersonal relationships, play and leisure, as well as coping skills. Emphasizing the client's needs for behavior analytic services once again, I did include their VB-MAP scores, in which we could see they scored pretty high in level 1, though when we get to level 2 and 3, they have not scored at all or have scored pretty low in most domains. So those are areas that we definitely need to work on and intervene on to get them more caught up to the common skills most children their age acquire. As previously mentioned, I am going to get more in depth on the current behaviors being measured, as we will later go into the function of each of those behaviors, behavior change goals, and consequence responses per behavior to help achieve those goals when intervening. Beginning with screaming, the operational definition is any instance in which the client emits an elongated noise for at least 1 second. That noise may be high-pitched or low-pitched noises resembling shrieking, yelling, etc. Each new instance of whining is separated by 5 seconds, and an example of screaming is the client screams for 2 seconds when a peer approaches her and touches her toys. A non-example would be the client stubs her toe and begins to cry. Common antecedent triggers are transition demands, presence of the therapist withdrawn or delayed, as well as interrupted play schemes. Moving on to the client's self-injurious behavior, which is head banging. The operational definition is any instance or attempt in which the client moves her body in any direction, resulting in the front, side, or back of her head making forcible contact with a hard surface, such as a desk, wall, cabinet, floor, door, window, etc. Each instance is separated by the client removing the contact between her head and the surface. An example of head banging is the client is sitting on the floor while engaged in a tantrum in the bathroom and begins tapping the side of her head against the wall. A non-example would be the client is bouncing a balloon against her head while playing. Common antecedent triggers include transition demands, the presence of the therapist withdrawn or delayed, as well as interrupted play schemes. Moving on to the third and final behavior, tantrum. The operational definition is any instance that the client engages in 2 or more of the following behaviors for 20 seconds or more. Elongated vocalizations resembling whining, yelling, screeching, etc., with or without tears. Throwing her body to the ground, flopping or dropping, flailing her arms or legs, head banging, throwing, swiping, hitting items around her, in other words, property destruction, and or physically refusing to get up or move from her current location. Each new instance is separated by the behavior being absent for 2 or more minutes. An example of a tantrum includes the client begins to whine while swiping toy ice cream off the table for 21 seconds when prompted to leave the sensory gym and go back to ABA. A non-example includes the client flops to the ground and begins to scream and cry for 18 seconds when prompted to use the bathroom. Common antecedent triggers include transition demands, the therapist leaving the client's immediate vicinity, transitions between therapists, interrupted play schemes, and reinforcing actions not working as planned. Now that we have a more clear picture of each of the behaviors being discussed in this presentation, I will now be getting into the function of those behaviors, which was determined through the Motivational Assessment Scale 2. This section will be referring to task list items F6 and F9, which are describing the common functions of behavior as well as interpreting assessment data. I chose to go with the Motivational Assessment Scale 2 as I'm fairly competent in this assessment as I've done it many times for many different clients. I was between doing this one and the QABF. However, I do think the MAS 2 is a little bit more telling as it does include more items to be scored, as well as separates escape attention and escape demands to have a more specific and clear idea of what the function of the behavior actually is. So beginning with screaming, the number 1 ranked function was tangible or access. Number 2 is attention, then escape attention, escape demands, and sensory. The number 1 ranked function for self-injurious behavior of head banging was tangible, and you could see on the chart all the rest of the ranked functions. For the final behavior of tantrum, the number 1 ranked function was tangible, then attention, escape demands, escape attention, and sensory. We will now get into behavior change goals, which pertains to task list item F3. Beginning with tantrum, the client will decrease the overall duration of tantrums from baseline levels by 80% for 3 consecutive months. There is a rationale below each of these goals that you could read through as well. Going on to screaming, the client will decrease the overall frequency of screaming from baseline levels by 90% for 3 consecutive months. And then finally for head banging, the client will decrease the overall frequency of head banging from baseline levels by 100% for 3 consecutive months. Behavior change goals, we will need to intervene on each of those behaviors through appropriate consequence responses. I will not be going through these responses verbatim because they do get a little bit lengthy, but they are provided on the slides for you to read and go through. Here is the self-injurious behavior of head banging consequence response. Finally, we have the tantrum consequence response on this slide. I want to thank you once again for joining me throughout this case review, in which we covered multiple different task list items in the F domain, including client descriptions, rationale for getting ABA services or behavior analytic services, interpreted functional assessment data and determined functions of target behavior, as well as got into behavior change goals and how to achieve them. Thank you once again.